Hello, I welcome you on behalf of Dr. Rahul Chaugale, at Little Smiles, Kolhapur. Today we will see structure of tooth. A tooth is made up of 3 layers. The outermost layer is known as enamel. It is white in color. It is hardest of all layers. Also it is hardest coating in whole biokingdom. Next layer is called dentin. Yellow in color. It is softer than enamel but harder than bone. It is comprised of microtubules which is filled with fluid. Here I have shown few tubules for understanding purpose. But actually they are huge. Starting from 15,000 per square millimeter near enamel and increases up to 65,000 per square millimeter near pulp. Innermost layer is pulp. This is fleshy tissue and contains nerves, blood vessels and fibers. Tooth is said to be vital if pulp is vital.
Caries causing bacteria are present on enamel. Caries starts on enamel. As there is no blood and nerve supply here, there is no pain for enamel caries. Slowly it extends to reach dentin. As dentin is tubular, it spreads fast. When caries reaches close to pulp, which contains nerves, patient experiences pain. When it involves pulp, it spreads rapidly and causes abscess formation at base of tooth.
Caries causing bacteria are Streptococcus mutans. They need hard surface to adhere. They cannot hold soft tissue such as mucosa. So they are absent until tooth erupts in oral cavity. When tooth erupt in oral cavity, enamel is colonized by bacteria, forming a layer known as plaque. This plaque is home for bacteria. Now these bacteria needs food for survival. This need is satisfied by carbohydrates. Carbohydrates that are easily fermentable, for example sugar, are utilized by bacteria as source of energy. But when they utilize carbohydrates, a side product is formed which is lactic acid. This acid start accumulating on tooth surface and causes damage to tooth surface. Now comes in picture defensive system of body. Acid formed by bacteria is neutralized by saliva. At same time saliva also repairs damage caused by acids by depositing minerals back to demineralized surface. This tussle of demineralization and remineralization is going on continuously. Thus this cycle of bacteria using carbohydrates and formation of lactic acid, that is demineralization and neutralization of acid, by saliva and repairing minor damage to tooth surface, that is remineralization, is going on continuously in oral cavity. This cycle has one more important factor and that is time. Let's see how it affects.
So normally pH of saliva is about 7, which is neutral. When we eat something, acid is formed and pH goes down. Acid formed will be more in quantity if food contains sugar. It takes about 20 minutes for saliva to neutralize acid formed and again pH reaches its normal value. But if we keep eating something every 30 to 40 minutes, or if we eat something that will stick there for a day, for example chocolates, a constant source of fermentable carbohydrates will be available for bacteria and acid production will go on continuously. Thus pH of oral cavity remains acidic for more time, and thus damages tooth. Saliva will not be able to neutralize or remineralize for such a long time. It can support us for 20 minutes. Better is avoiding frequent snacks. Keep duration of 2 to 3 hours between two eating.